On our morning show from WRCO Radio, we're talking about physical therapy, National PT Month, in fact. And from the Richland Hospital today, we have Kara Watson and Amy Hergert, who are joining us to talk about physical therapy and what it's all about. So why is there a National PT Month, Kara?
I think it's just a great way to highlight the services that therapy provides. It's not the first position that you think of when you think of healthcare, but it's definitely an integral one.
Amy, maybe you can tell us about what are the different types of physical therapies?
There's quite a bit of services. That's what I really enjoy with when I chose the career that I'm in. You can work with kids, and you can go all the way down to, orthotics and different things like that, all the way up to centenarians and working on balance and falls. So I started here at the Richland Hospital doing school physical therapy, and then moved into doing more of an outpatient ortho. And in the rural area, what's really nice is I might work with someone who has dizziness or concussions, and then I might work with someone who had a total knee. So there's just quite a few different options and niches. I don't do like lymphedema, another therapist does, but you get specialized training. Just like with us in the vestibular, we did a Herdman's course, which makes us more qualified than someone who just gets out of school doing vestibular and different things like that. So there's quite a bit little niches. You can become orthopedic certified, all those different things like that.
On a typical day, you could treat somebody who was in their teens and then somebody who was in their upper whatever, right?
Yep, that's true. Yep.
So never a dull moment then, right?
It really isn't.
She talked a little bit about the qualifications here. Herdman's. Could you talk a little bit about that, Kara?
So Susan Herdman is she is a practitioner that kind of wrote the book for vestibular rehabilitation. She's currently a professor at Emory University and has developed this advanced training where clinicians from across the country can come to a week-long intensive course, and they are learning from the latest, the brightest minds at Duke and Emory universities. And we're just getting the people that are teaching this course are literally writing the research articles. They're literally writing the clinical practice guidelines that clinicians across the world are using to treat people with vestibular disorders, and we got to learn from them. So it was a really unique opportunity, and it's kind of a big deal. And I consider myself very fortunate that I work at a hospital that invests in its staff and provides opportunities for us to go to advanced training courses. And I think it really speaks to our mission to provide the best care for our patients, because it's our patients above all else.
Do you feel you're kind of on the cusp of things? You're kind of...
well, we try.
Yeah.
We
but
try.
But going to this, you're kind of you're kind of taking a step forward with this, aren't you?
Yes, and so it's been a couple of years since we've been, but we are in contact. We are always kind of trying to stay up to date with what the latest research provides, and going to that course helps us navigate through what to pay attention to and what isn't the best information.
I think you touched on a little bit, Amy, but what are some of the common injuries or conditions that you see and treat at the Richland Hospital?
Again, going back with my pediatric kid background, I feel like you can work with anyone who has developmental delays, genetic issues, hypotonia, all the way up to, again, going back to the older generation with someone who's just struggling with their everyday needs, and even like a traumatic brain injury, someone having a concussion. So it really is just, we have an open, schedule, and whatever eval we approve, like I said, I don't do lymphedema. So really it could be any kind of diagnosis. What we were kind of trying to hint at is that, if you feel like you're not able to do things that you used to be able to do, if you have pain and you're not able to control it, that's our whole goal, is to make everyone's life a little bit better. So
I learned something today. I never would think about treating a concussion with physical therapy. What do you do for a concussion typically?
Yeah, so with a concussion, it has to do with the movement in the brain. And so if you take an MRI, they actually don't show any specific injury. It's the lowest form of a traumatic brain injury. And so what happens is the connection between the right and the left brain kind of gets a little muddy, and most people will complain of headaches, dizziness, light issues, different things like that. And so what we do is teach you how to reorganize that in your brain a little bit more. So there's other avenues. So if you had a severe concussion, you might even need speech or OT for cognitive things. But at the most part, typically, if it's a younger adult, they're working with their athletic trainer and with us. And the number one goal is to make sure everyone's safe to play when you think about a younger adult and different things like that. So
It has to be a rewarding job, Kara, when you look at it, because you got somebody that maybe has been putting up with pain for several years, and if you can, maybe get rid of it or at least get it down to where it's a manageable level, that's got to be satisfying for you, isn't it?
It is, and I think one of the best parts of my job is the people that I've met and the patients that I've developed relationships with, and if we can get rid of the pain, great. But most of the time, we're just trying to help you be able to function a little bit better. And it's been really rewarding getting to know people over the years. I have some patients that I've seen multiple times on and off for the past 5-10 years. So it's been really nice to get to know them and figure out how to help them on their healthcare journey. It is very rewarding.
If you give somebody some exercises to do at home, you can probably tell how diligent they have been. I guess I'm kind of speaking about myself, I mean.
You confessing?
I'm confessing a little bit. But you can probably tell, who's been really taking it to heart and who's not, right?
Yeah. And I mean, yes, doing your home exercises is very important because there's not like a magic wand that we can wave over people to make things better. It takes active involvement and participation, but life gets busy sometimes, and there's practices and games and family dinners, and maybe you weren't the best at your exercises that week, and that's okay. Or maybe we rehabbed you to a point where you were feeling really good and life got busy and then things are not great again. I like to think of therapists as almost like mechanics that provide tune-ups. So we're here whenever you need us to help you feel better.
I think everybody probably, they heal differently though, right, Amy? I mean, you can't compare yourself to somebody else very well.
Oh, for sure, definitely. I was just going to say, I also think of myself as you and this person are making a recipe together. So someone might need 20 exercises, someone might need one exercise. It's more about, how they think about things and different things like that. So,
how many people work in physical therapy at the Richland Hospital? Any idea?
Oh, I'd have to count.
Yes.
I could get you that information. I would just have to count.
Takes a little while.
I would at least, I would say 10 to 15.
What we find really interesting is the program started with Deb O'Connell, and it was a one-man show with the PTA, Chris Mulligan. Chris is still there, so that's exciting. Deb retired, and the way that they've grown the department and the program is pretty exciting. So again, we just keep offering services, and then we keep meeting the needs of our patients and our community. So when we're having difficult times, we decide to add one on and different things like that.
Mm-hmm.
So.
I'm amazed that you had, one or two back in the day then? That is all?
Yeah.
Mm-hmm.
Yeah, that's crazy.
For everything that would be inpatient and outpatient.
And
schools.
Peds.
Yeah. So
that's unreal. Mm-hmm. So do you work more with the hospital then, or do you do more with the clinic, or how does it work?
So we have therapists that work in a variety of settings. So we have therapists that work in the school with kids. We have therapists that work on the inpatient floor. So if you are admitted to the hospital because all of a sudden you don't feel well, maybe you have pneumonia or an exacerbation of heart failure, or you broke your leg, or you have a stroke, there's a team of therapists there to work with you and your family and your care team to kind of come up with a great homegoing plan. And if we don't think that homegoing is the safest or best option, then we talk to you about, other services that you can pursue to help you get strong enough to go home. We also, you might get to the point where medically you don't need to be admitted to the hospital and under the direct care of a doctor, but you're not strong enough to go home. Typically in that situation, we would refer you to a skilled nursing facility for some further rehab, but we also can provide a swing bed program where you stay in the hospital and work with therapists just to get strong enough to go home, as insurance allows.
You work with a lot of cardiac patients as well, or is that
So we have
different?
we have a fabulous cardiac and pulmonary rehab team. So they do a lot of work on the outpatient side. But yeah, if you're admitted with a heart attack and are having any functional limitations, our therapists are on the floor working with you in conjunction with the medical team.
In outpatient, we kind of coordinate to, like, are you able to balance and walk in a certain amount of time? So, we can perform some of those activities, but it's better for cardio and pulmonary, have like the specific tests they put things on to monitor the heart and different things like that. We just monitor vitals. And then I was going to say too, there is outpatient facility in Spring Green. Kelly Miller goes there, and then like with the schools, that's a contract, so that's why the athletic trainers are hired by us, but the school wouldn't be able to manage just that type of, there's not enough need or different things that come into with that. So that's why the contract allows so they're all based from the hospital, but then do these services out in the community.
We see Bree and Lindsay a lot of times at the athletic events too.
Mm-hmm.
And for older residents too, everybody wants to stay in their home as long as they can. So that's probably a motivating factor, isn't it, for some people to try to get better and have better balance and those kind of things?
Oh, for sure. I think that's what it's really important is when you come into therapy, you bring us your goals, whatever that may be. And a lot of times it is that, being able to go take care of your grandkid or go to that, game or deal with sitting and all those things. So.
What about treatment plans for individual patients? I don't know if we've carried that yet, Kara?
Well, kind of like what Amy was just saying, there's no cookie cutter approach to anything. I could see 3 different patients that have all undergone total knee surgery, and I'm going to have a different plan for every single one of them. Yes, there's going to be some overlap. Like everyone's going to have to do heel slides, and everyone's going to have to work on quad strengthening. But, one patient might be a grandmother that takes care of her young grandchildren, and her needs are different than another patient who might work for the DNR and have to get into a canoe. So you're going to, at some point, you have to really get to know your patient and understand what's important to them and have that conversation about what they want to do and what they want to prioritize, and then make a plan to make that happen.
I've, of course, recently had a hip replaced, but is it easier to get over that than knee replacement, or does it depend on the patient, Kara?
Oh, it depends. Traditionally, hip replacements are less rehab intensive than a knee replacement, but there's definitely hard work that goes into recovering from both of those surgeries.
Sure. And different things, the heel slides, as you mentioned. And it's interesting, each therapist, it seems like, has maybe kind of their own idea for what you should do and things like that. Do you find that the case?
Well, we all have our own flair. We really work hard as a team to make sure that we are up to date on what the latest and greatest research is saying on how to best manage patients, because that's what helps people get better quicker and more efficiently. Insurance also likes that too. So I really think our team is like-minded and understands what the pillars of therapy are. But yeah, everyone's going to have their unique flair.
I would say every physician also has protocols. So one protocol might be that, that they want a certain aspect, like they can start walking really soon. Another one might want to wait 4 weeks. So we have to follow those guidelines as well. So
you have a regular gym and workout facility at the hospital, don't you?
Just us. There's no actual gym where you can come in.
I know. But you got some equipment and some.
There's quite a bit of equipment there.
Things to ride. And
Yes, yeah, we've got new steps, treadmills, recumbent bikes. We have a true weight system to help with strengthening. We have a whole closet full of things to help with balance. We have a lot of really great equipment to help people on their healthcare journey.
Another question for the both of you. What advice would you give someone who is hesitant to seek treatment for chronic pain? Amy?
I feel like someone has to be ready to make changes would be the number one thing, is that what you're doing right now isn't working for you. So taking in that information. And what I would say, again, So if you have someone who sprains something and it's very specific, chronic pain is a very difficult thing to manage. And so I'll tell people it's like learning a toolkit. So this is the thing that you need to do for this type of pain. This is what you need to do for this type of thing. And the people who are able to move around and figure out, is that a stretch pain? Is that a pain like I'm hurting myself? All of those things are the most important thing with chronic pain, and dealing with pain. But actually, when I was in school, the thing that caught me was that they even say a total knee prior would have been chronic pain because it's anything that's over 6 weeks. So when you're coming in and thinking about therapy, if you don't have a specific goal, if you don't feel like you'll be able to make changes, or like you want to be able to walk 10 minutes and you're not going to manage that and keep with that, then the likelihood of improvement is going to be a little bit lower, because I'll get people to where they want to be and then they'll backslide, which isn't a bad thing, but it's just going back to trying to stay motivated and what's your reason why of coming and things like that. That's really helpful.
Carrie, do you want to add a minute?
Well, I guess my advice to anybody that's hesitant about trying therapy would be the same as my advice to somebody car shopping or looking for a new restaurant. You don't know what you don't know. So if you've never tried it, you don't know what your options are. So there's nothing wrong with coming in for an evaluation. There's no strings attached. Nobody's going to keep you there. We have a really great team of people that really just want to help you. So I would say give it a shot.
What does an evaluation entail then? Is it question and answers, or how do you do that?
Oh, a little of everything. We got to get to know you. We got to get to know your story, what's important to you, what your goals are, and then we do a comprehensive assessment of all the body structures and systems that are contributing, let's say, to your shoulder pain, and then we kind of talk to you about what your priorities are, and then we make a plan for how to address all the issues so that we can get you feeling better.
Any other news from the Richland Hospital you'd like to share today? Anything coming up here in the near future?
Well, I think we still have our vaccine clinics are open for appointment only. You can get vaccines. You can schedule to get a vaccine at the hospital, at the Spring Green Medical Center, at the Muscadet Health Center, and also the pharmacy at the hospital.
Yep.
We have
the walk-in mammograms end in October, but if you haven't been able to get in, call for an appointment, and they can find a time that works for you. So there was that piece.
Yeah.
Mm-hmm.
Yeah.
That's as far as news is concerned.
That's big news.
Yeah. I talked to a lot of high school seniors. They're talking about careers. Seems like more and more people are kind of gravitating a little bit toward physical therapy. Do you see that?
That'd be wonderful.
Well,
we have a need.
You have a need for more?
Yeah.
I think many of them are motivated by the trainers that they see at their local schools, correct?
I mean, Lindsay, who wouldn't want to be Lindsay and Bree?
Yeah, exactly. Right.
They're really fantastic people, and they do really important work. And we do have a shadow program where students thinking about a career in healthcare, maybe they're not sure if they want to pursue a physical therapy program or an athletic training program, or maybe even an exercise physiologist. They can come and they can shadow the people doing the work so they get an idea of what that feels like. So we work with many students and help them figure out what they might be interested in.
I would say there's at least 50% of patients or PTs who have had past experience. Like I had TMJ jaw issues, and I know that Kim Darcy-Liska, who works in PT, had knee issues. So when you get in there and you kind of see what we do, it's, it has to be somewhat exciting for someone to have a position there. So,
And you can speak from experience if you've had, physical therapy yourself then too, can't you?
Yeah, I think, our ultimate goal is, can we make you healthier? Is there a way to do things without, procedures, different things like that? I mean, I'm not always recommending not to have a procedure or surgery, but if we can, decrease the likelihood. I mean, if you think about research, that's what they're looking at when they're doing certain things. How beneficial is it and stuff like that. So that is exciting not to have to do those things. So.
Mm-hmm. And sometimes, Kara, insurance will make you kind of jump through the hoops, so to speak, like, let's try this, and if it doesn't work, maybe surgery's the next option then.
Yes, and I will say to that, the reason why they're doing that is because there is a lot of evidence that therapy can help with things. And like Amy said, we can't prevent every surgery, but there are a number of people that came because they needed the 6 visits before they could get their MRI, and they're like, I actually feel better. And there's no reason why you have to do one or the other. You can continue to do therapy and continue to talk to the surgeon and figure out what works best for you. So
great. So if we're out there and we're experiencing pain, call the Richland Hospital, and see if we can make an appointment and see where we go from there. If I'm trying to make a comeback in church league softball and I need to get back there, you guys could help that too, right?
We sure could.
Sure, maybe. But as far as making contact with the ball, you probably can't help that, though.
I don't want to make any guarantees there.
All right. Well, thanks for coming in, ladies. Thanks for what you do.
Yeah, thank you.
Thank you.
And happy Physical Therapy Month.
Thank you.
You bet. Amy Hergert and Kara Watson joining us from the Richland Hospital on this portion of the morning show.